Welcome, everybody, and thank you for joining us for this month's Thought Co-op. You know, the Chamber's been talking about this topic since June of this year. And that was really prompted by our businesses reaching out to the Chamber and saying, you know, someone really needs to be talking about homelessness in our community. And we knew from our membership that an organization called Change the Trend was already actively exploring this topic with a variety of partners within our community. And so with them, back in June, we put together a presentation that many of you attended to talk about the faces of homelessness and what does it look like in our community, and really in part how we could all work together. And so since that program, we now receive calls and conversations that really address what's next. How do we move forward on homelessness in Englewood? And so we are very excited today to have both of our speakers to really talk to us about a plan that has been put together by Englewood, Littleton, and Sheridan that's going to give us the steps to move forward. So let me introduce to you Tim Dodd, Assistant City Manager with the City of Englewood, and Sergeant Reed McGrath from the Englewood Police Department. Tim, I'll let you take it from here.
Thanks so much, David. So I want to thank you and Lindsay and the entire Chamber board and Chamber members for having us today. As you mentioned, I will be presenting with Reed McGrath, who is a sergeant here in our police department. So I'm going to start by going over a little bit about a plan that we developed and 3 cities adopted. And then Reed is going to talk about different ways of getting involved. So the Tri-Cities Policy Group is a group that's existed since 2018. It's made up of the 3 cities of Englewood, Littleton, and Sheridan. It meets as a committee on a monthly basis, and it also includes service providers, a representative from the state, representatives from the county, and others who are involved in this issue. And I think it's really important. I think, as you're all aware, obviously homelessness knows no bounds. And so really, if it just was Englewood or just was another community working on it, it's not going to get very far. And so that was why the 3 cities decided and recognized the importance of working together. And so this is really why we exist as a committee, as a group, to develop and implement a series of regional strategies that I mentioned, important focus on the region. And then it's based on scientific research and community engagement. And reasons why we're doing this really are to alleviate the impacts of homelessness, of course, on those who are experiencing it, but also on the larger community as well. And it's really, I think, important to know the scientific research part. I think just human nature, sometimes it's easy to focus on the symptoms as opposed to the root cause, but really to solve any issue, you really need to understand the why. And obviously, one of the things that makes homelessness so challenging is that there are many whys. There are many different reasons why people are homeless. But as we're going to talk about in this presentation, really to solve for it or to solve for anything, you really need to identify differences between individual homelessness, family homelessness, the importance of work programs for some and other types of programs for others. And so really what we did in terms of developing this presentation and this program, we hired a consultant who was a great presenter. Unfortunately, she couldn't make it today. And she spent basically last January through about April, she conducted 53 different stakeholder interviews. And again, these involve, city councilors, state officials, federal officials, service providers, people who were homeless. And basically, that was really where a lot of the data points came from. We also, the Tri-Cities had done kind of a few studies in the past as well to understand the root causes, again, of homelessness in the area. So we contracted with a center at the University of Denver that basically did 2 studies, one on chronic homeless and one on individual, or one on family homeless. And then we also did something called a PESTEL, which is noted here, which is basically a political, economic, forget the S, actually, technology, environmental, and legal, I believe. And so basically it's like a SWOT analysis. And so we conducted that, we collected all this data, And when Alyssa, our consultant, was meeting with stakeholders, she asked them these basically 3 straightforward questions. What's working, what can be improved, and what priorities would you like to see in our action plan? So this again just quickly goes through who the stakeholders were that were involved. I kind of mentioned some of them. So obviously talking to law enforcement, talking to Denver, obviously, as our much larger neighbor to the north, wanted to make sure that our work was in line with them as well. We're very, and Reed's going to talk more about this, but we're very, very fortunate to have an organization in Englewood that you may be aware of called Change the Trend. It's basically a coalition of over 30 nonprofits. They were instrumental in doing this work as well. So some of the themes that kind of came across as we developed this initiative, there were several hopes, and really the main hope is that we do have, we'll have great services that are provided through the region. And this is something I've seen in working with Change the Trend nonprofits. We're incredibly fortunate as a region to have such dedicated nonprofit employees and volunteers. It really, it's not something you see everywhere in terms of this level of dedication and passion. And I think we're very lucky. Of course, some of the fears do relate to money. Homelessness obviously is something that it's very expensive in terms, or can be very expensive in terms of obviously being proactive in programs and initiatives. But one thing we don't, a lot of cities don't have great data on is how much it costs for us to be reactive to it. And so I think there's a good case obviously to be made for the importance of programs and initiatives, but there are dollar signs attached to this work, of course. And then another challenge that I've seen other places as well is if you are seen as providing top level services, then sometimes you may be seen as a place where people experiencing homelessness come to. So that was also a fear that was expressed. And some desires were to streamline access to services and also to increase data collection to basically understand the needs of those should be real time, but those experiencing homelessness in the region. So several findings that were found through this work: the need to strengthen local and regional coordination, to identify the uniqueness of helping those who are individuals, which we sometimes refer to as those experiencing chronic homelessness, as well as families, to coordinate homeless activities among staff. And that's something we started in Englewood. We have an internal group that meets once a month called the HAT, our Homelessness Action Team, to streamline access to services and provide navigation support, increase participation among homeless service providers. So, we do have quite a few organizations out there. How can they work together in different ways? To provide an alternative to law enforcement. I think Rita will talk a little bit about this. Englewood really is kind of led in these issues, but there are these models out there that basically engage people with a social work background to an extent in law enforcement and making sure that we're addressing different issues in different ways. To leverage partnerships with public and private partnerships. And then this last one obviously is definitely a challenging one, but one that we recognize is important: expanding housing opportunities to increase successful exits from homelessness. And so we wanted to, again, one of the great things about the consultant that we hired is that she basically was the coordinator of homelessness efforts for the city of Los Angeles, for the city of Santa Monica, and also did quite a bit of this work for the city of Philadelphia, and also for nonprofit service providers. So she came to us with an incredible understanding of best practices that were out there, developed relationships immediately with people that are doing this work in our area. And so basically the state kind of had identified these 4 big goals for homelessness in the state of Colorado. So stopping homelessness before it starts. And this is something that we're definitely trying to focus on as well. Identifying that, we focus on people in terms of homelessness who are already there, but there's many people in our communities that are on the brink of becoming homeless. And so we definitely want to focus on initiatives to prevent them from becoming homeless, identifying individuals at risk and ensuring they're safe. Obviously, safety is very important for everyone involved. Connect people with the supports they need, and then create access to long-term structural solutions. And, as I mentioned, I think the way out of homelessness definitely depends on the reason of why you're homeless. There are some great ready-to-work programs out there for people who are ready to work. Those aren't for everyone. There are some programs that will help people get housed pretty quickly. Some people are not ready to be in permanent housing on day one. Many are. And so I think that's why the data collection is so critical to understand why individuals are experiencing. And then below you see some proven solutions that are recommended by MDHI, which is a big organization in this area that we basically we're involved with every step of the way to make sure we're aligning our work. So supportive housing essentially is just housing where there's obviously support and programs that are provided. There's a variety of different prevention diversion programs. I'll go through all of them, but we can certainly talk about these later if there are questions. So basically, this is kind of the structure that where has been proposed. And so I should have mentioned earlier that the plans have been adopted, but this plan has been adopted by the 3 cities. And so now it is our plan for the 3 cities, and we're working with the county to start to operationalize it and to start to make the contents of the plan a reality. So as I mentioned, we do have this Tri-Cities group. We are now on this blue box right below it is really where we're at right now, recognizing that we have to have a coordinator who can help the 3 cities and also working with the county to coordinate all these efforts to make sure the actions of the plan are being done, and then also to report on them. One of the things that came up, I think, in all 3 council discussions was the need of measuring success. And so we really do eventually, hopefully sooner rather than later, there will be a dedicated website for the Tri-Cities. And we do want to get to the point of having a dashboard and basically showing not just where we're at with deliverables in the plan, but basically developing a system of some key metrics, both to track how successful we are in implementation of initiatives, but also are we achieving specific outcomes for people experiencing homelessness. We do also plan eventually to create something called a lived experience advisory board, which basically means people who had experienced homelessness playing a role in basically helping us to shape these programs. And obviously housing authorities play a role, the individual cities, and then the service providers that we have that I mentioned before. And so this is just an example to show a pathway for single adults experiencing homelessness that could hopefully be a pathway out. So basically starting with different referrals that could come from outreach that we're doing, client services, referrals from constituents, city staff referrals, and then we'll go eventually into something called a navigation center that we really are committed to doing. So a navigation center is essentially meant to be a one-stop shop where we can collect data on people experiencing homelessness and then identify what the service needs are. We think having some kind of navigation center is critical to our success. Then after they go through the navigation center, they would then be given the programs that are going to work for them. As I mentioned, they may be different. For some individuals, it's diversion programs, others it's housing, some it's supportive services, some it's employment assistance. And then the idea is that, with those supports, based on the data that we've collected through the navigation center, they would be able to exit homelessness. Similar, but slightly different for families. Every school district in America is required to have something called the McKinneyVento Coordinator, and essentially that's a homelessness coordinator. We have worked, and I think the plan is to work even closer in the future with the Englewood public schools and other school districts in the area to make sure that we're working and identifying families experiencing homelessness. So a lot of times with families, the referrals actually come through the schools, through that coordinator. Sometimes they're self-referrals, sometimes they're community referrals. Then it would go through a navigation center, and then the same thing. There would be specific supports for families to help them get homelessness. So I just want to go through the recommendations really quickly that we're going to start implementing from the plan before I turn it over to Reed. So basically there's 4 themes, and really these are kind of our 4 big buckets that the plan focuses on. The first one is governance, the second one is individuals, the third one is families, and then the fourth one is related to job development. So the first thing we're focusing on is building a strong foundation. So working to kind of look at the Tri-Cities model to make sure it's the best model that's possible, to solidify our relationship with the county. Again, really realizing that this is a regional issue, and creating hiring a coordinator, creating a lived experience advisory board, ensuring that the cities are engaged in this process. And so this is really where we're at right now, is building our strong foundation. Also, the second big theme of the plan is developing a single adult system, meaning that we want to do things like streamline access to services for single adults. Street-based services are basically direct services where people are actually going out literally on the streets or in the parks, looking for people experiencing homelessness, and then either usually not providing services directly to them there, but helping them navigate those services and get those services, and then also expanding housing opportunities for single adults. Also, as I mentioned, the workforce development programs. This is something where we're working right now with an organization called Bridge House Ready to Work. And we're actually looking at a site, looking at the idea of a site in Englewood in the next couple of years. But basically, this is a program where people who are homeless, who are ready to work, are basically housed in dormitory style housing for about a year. And then during that time, they're also given job training. Typically, it's in areas that meet with the needs of that region. So things like culinary, landscaping, graphic design, carpentry. And then basically after a year, they graduate, and then there's assistance in terms of being placed in a job, and also being placed in housing. We feel that, again, this is not, not everyone in the homeless continuum certainly is in this space, but many people are. And so we're very excited about the possibility of having a program like that in the Tri-Cities. And then, as I mentioned, the family system, so streamlining services, preventing, and with families, it's, with chronic homelessness, typically at that point, they are on the streets, they are homeless. One of the things we saw in our initial studies with family homeless is that there's many families that are homeless, but they're with a relative or other family members or friends. And so sometimes that's why it takes, a little bit of sometimes the schools being involved to really identify these families as being homeless, and making sure that they are able to get a home of their own, and the right supports they need, and then to create housing opportunities for families. So now I'm going to turn it over to Reed, and I'll keep sharing my screen, Reed, to talk different ways about how to get involved. And in doing that, I think one thing that's really important for me for us to recognize is certainly homelessness is a community challenge that involves everyone. So while the city is an actor, and it's a very important actor, really to solve homelessness, to work on homelessness, it involves everyone. It involves other governments in different layers of government. It involves individuals. It involves nonprofits. It involves businesses. And so really this is, for us to really achieve the things that we hope we'll achieve through the plan, it really needs to be a team effort across the board. I'll turn it over to Reed.
Thanks, Tim, for the comprehensive overview on something that took a tremendous amount of time and effort to prepare. It's great to be with you guys today. I see a number of you that I know, and hi Sarah, it was great to have you on that panel we had several months ago as a business representative. So thank you for that, and good morning to everybody else. I want to start off by talking about Change the Trend. The efforts you've just seen is Tri-Cities related. I'm going to talk about that in a sec, but Change the Trend is an Englewood specific group, started as about 4 years ago. The Pastoral Alliance in the city of Englewood came to then Chief John Collins and said, hey, what's a problem in the community that we could help you with? And he said, it's homelessness. So we began meeting and started out a good Change the Trend meeting would be 12, maybe 14 of us. Mark McIntosh has been involved for many years in that. He's on this call. And we started making some things happen, doing some educational events in the community. Change the Trend really exists to connect other organizations. In and of itself, Change the Trend really isn't a dynamic organization, other than we have a great meeting on Thursday morning at 9 o'clock where we bring partners together and we collaborate and make things happen. changed the trend when the COVID pandemic hit, became a go-to local resource because we were already doing a lot of things, and we suddenly morphed into going from about 12 people on an average week up to 50. Now we're averaging in the 30s pretty consistently, with service providers across the spectrum, from often Tri-County Health Department is involved to a number of nonprofits. What we need and change the trend that we don't have, specific to why I'm talking to you today, would be some business partnership and some volunteers. Many of our organizations need help. They struggle. Most of our organizations are short of the Tri-County Health models, are pretty small organizations. Some of them are all volunteer, and they definitely need some volunteers. We need people to walk alongside some of our homeless people that are motivated to get help, to mentor them. That's something that Mark McIntosh does, but we really could use one or two people from the business community to just show up at some of the Change the Trend meetings and find out what's going on, and have some valuable input into, where are we moving to, what are we doing, how can we better operate as Change the Trend. So just be thinking about that. And I want to move into a little bit about the city of Englewood and the Englewood Police Department specifically, and what we're doing. So I mentioned, and Tim has certainly talked about, the Tri-Cities Homeless Policy Group that this has put together this amazing thing. This started, I believe it was Mayor Olson's idea, and under a different administration. And they have just done a great job of identifying the problem and building a solution to it. And it's been a impressive work that's continued. We work at the county level too. The county's had some involvement in that. I sit on a county group periodically as well, and that is an ever evolving concept. The city of Englewood, with the new leadership we have, has really stepped up and moved above and beyond what was happening before. So I just want you to be assured that we as the city and the police department are incredibly active in this issue, looking at resources and solutions and partnerships, and how do we make this some solutions to this problem. We're never going to solve this problem. It's a problem that's always existed, and it always will exist. But how can we lessen the impact of it for people experiencing homelessness? How can we lessen the impact of it for people, otherwise affected, such as the business community in Englewood? So very, very much a deep leadership in the city of Englewood, and a deep commitment to dealing with this issue. A couple of the cities around us, like Denver, have a specific tax incentive or revenue that comes in that the citizens voted on, that helps them with all the resources they have. And here locally in the Tri-Cities area, that isn't the case. The cities have just picked up this issue and gone with it, and doing everything they reasonably can. At the police department level, I think most of you know that we have the co-responder program. We're about 3.5 years into that. We started with one full-time co-responder, actually part-time, quickly moved to full-time. We now have 2 full-time co-responders. And this year we added a homeless case manager. She went full-time in February. She has been a phenomenal resource for us, outreaching homeless people. She's identified over 200 people, unique individuals in the Englewood specific area experiencing homelessness. Of the people she's identified, she's done over 70 VI SPDATs. That's a fancy name for a vulnerability index that actually puts people into a housing queue based on their level of vulnerability. And Tim mentioned MDHI. That's a group that we meet with, and we're on one of their committees that we regularly meet with. And MDHI coordinates One Home, which is the Housing Management Information System, HMIS. So we're working towards getting the people that we contact on the street into housing. We've had some success. We've seen a few people come off of that vulnerability index into housing. We've got a couple people into Bridge House, and some of our partners have gotten some people into some permanent supportive housing. So we're excited about that. And really, that's really my formal presentation. I would hope that the business people and others on the call might have some questions.
Thanks everyone for joining us today, and don't forget to subscribe to this channel for more programming from your chamber.